Okie dokie, Evan Benton of Dogg from Air, back for you with the second part of the SPARS document. Let's get right to it. All right, and we're starting back with chapter 10. And so chapter 10 is talking about the vaccine rollout. All right, so it's June 2026, about 8 months later, and we're finally getting expedited review. I forgot to mention something back at the beginning. The beginning says, how do we make how do we make the vaccine seem safe? How do we make people think that it's gone through the final, even though it's a shortened development schedule, how do we make people think that it's still gone through the full development, that it's still safe? And so that's ridiculous. As I mentioned, vaccines take, on average, 5 to 10 years to develop. You can look it up. And you just simply can't go through all of that in a few months. So really, one of many examples in this document where it's just how do we lie to people effectively. But a big difference with the way they rolled this out in this scenario is that children, young adults with chronic respiratory conditions, and pregnant women get the vaccine first. And so they don't give it to the first responders, and they don't give it, well, in this scenario, the elderly aren't getting sick, which is really not how diseases typically work. But because they don't give it to doctors and nurses first, people protest. So yeah, I don't think this is very realistic, but what's really interesting to compare with the COVID-19 thing is we have just a huge surplus of vaccines and we have an incredible lack of demand. Okay, so in this scenario, they're thinking people are just going to be, lining up to get these vaccines and they're going to be denied. But what's happening in reality is people don't want the vaccines and they're having to lie to them to try and make them get it and guilt trip them into getting it. And so here we have the protests due to the rollout. Oh, well, okay, this is about, they're rolling it out based on the federal government using patients' electronic health records. So lots of privacy issues to get into here. And they're just saying, how do we spin this to say that we're not violating people's privacy? Not too interesting. Doesn't go into much depth there. Yeah, here we go. Okay. This is crazy. So here's a scenario where at the beginning, just as they get the vaccine to roll out, there's a massive power grid failure at the Grand Coulee Dam in eastern Washington, which is the largest power plant in the United States. Really interesting. Someone just told them to throw this in there. Now, we did have massive power failures right around the rollout of the vaccine, and we had massive snowstorms and things in places that didn't usually have them. But that all coincided with the stolen election, and so that kind of stole the thunder from this thing being compared to the vaccine rollout. But the coincidence is there. But what they're saying is the real problem with this power grid failure is that the government, pro-vaccine, pro-medical countermeasures narrative was all being tied to electronic media, and so that went down during the blackout, and they had to go back to like flyers, like physical flyers and things like that. And then the anti-vaxxers show up, and there's 4 groups of them. This is just goofy. These are the 4 primary anti-vaxxers groups. Okay, Muslims. And Muslims don't like it because it came from pigs. The vaccine came from pigs. That's really what they have to say. And, why do they say Muslims? when we know Orthodox Jews are very opposed to vaccines? Well, probably we know why. Why do they use Muslims when we know that Christians are opposed to the use of aborted fetuses in developing vaccines? Hard to say, but here it is. Muslims are a big group. Yeah, right. African Americans. Hard to say where this came from in their mindset, but I wonder if this has anything to do with all the rioting that went on last year. I wonder if somehow, this kind of thought the African Americans were going to oppose the vaccine in droves somehow led to them being mobilized as the Black Lives Matter. Um, it's even going to go on later, and it's going to say, ironically, that they repurpose the Black Lives Matter thing. Am I going to be able to find it? Yes, look, they're repurposing hashtags like hashtag Black Lives Matter to, oh my goodness, to actively campaign against the vaccine. That's what they're saying. And then the last two anti-vax groups are anti-vaccination activists and alternative medicine proponents, not necessarily in that order. My question is, why are these two different groups? Is this just a divide and conquer thing? So you can be a crunchy mama and not be an anti-vaccination activist? Kind of what it looks like to me. All right, my notes on page 46. By the time Coronavax distribution began in July 2026, it was clear that not only did SPARS infect children more frequently and severely, but even mild cases of the disease often gave rise to secondary bacterial pneumonia in children. These infections occurred between 4 and 6 months after initial infection with SPARS, resulting in greater rates of pediatric morbidity and mortality from the disease. So, most of the time diseases affect the elderly. They're going to affect very young children before their immune system is developed, but the secondary infections, that's totally reasonable, right? Your immune system is weakened because you've been fighting off a disease, so you're going to be more susceptible to secondary infection. And we didn't see this. We haven't seen this at all in COVID-19. That's very strange. So we're kind of, to give them a little bit of slack, we're kind of dealing with a real disease, or, what we think of as an infectious disease with the SPARS. And COVID-19, this is just showing us that COVID-19 is something completely different, because in lieu of these secondary infections, we're actually seeing something called long COVID, which is a prolonged fatigue and a loss of sense and smell and taste, and shortness of breath, and all kinds of crazy things like that. So it's a new phenomenon. And chapter 14, we are going back to what if other countries don't like what we're putting out. Okay, so in this part of the scenario, what if Japan doesn't approve the American vaccine? So now they're not approving them because they're not effective. They're not approving them because of the possibility of chronic long-term side effects, okay? And this is problematic. What does it say? The decision was particularly controversial because of widespread SPARS transmission across Japan. Okay, so this is a very big difference from COVID-19, because COVID-19 has not been particularly widespread in Japan. Now, if you had an infectious disease, it would just spread, okay? And that's not what COVID-19 is doing. But then a little interesting thing is somewhere in here it mentions that we're getting a pro-vaccination movement showing up. Okay, yeah, emerging pro-vaccination movement. Imagine that coming around today, right? The pro-vaccination movement in the age of coronavirus is terrified and sitting at home, clutching their pearls. Okay, there's no possibility of them emerging from their bubbles and joining together. So that's very interesting, I think. And then chapter 15, we are back to the woke Reddit. And this is bizarre, but what they're saying happens in woke Reddit world is that college students protest because places like Haiti, Guatemala, and Cameroon did not have access to the vaccine. Imagine, again, college students in this day and age protesting something. Alrighty, I'm on to the last page of my notes. Global vaccination efforts up to this point were limited by vaccine supply, and while they had a moderate effect on SPARS incidence rates, the disease continued to spread steadily worldwide. So despite the vaccination efforts, the disease continued to spread steadily worldwide. That is something we're definitely seeing, as if to say that the vaccine were not effective. Continuing demographically, vaccination rates across the United States were mixed. Rates were high among Filipino Americans because in this scenario, they got it from the Philippines, and people went from St. Paul, Minnesota, went to the Philippines and brought this disease back, and so there's this anti-Filipino sentiment. So all the Filipinos make sure to get vaccinated. So rates were high among Filipinos, healthcare workers, families with young children, and individuals who identified themselves as Republicans. Whew! That's really what they thought. They really thought Republicans were going to be more likely to get the vaccine. Goodness gracious. So, and then we just go back to it's antibiotics. So what happens in this scenario for you to role play with your friends is, what if we run out of antibiotics because there's so many people with secondary infections? But wait, haven't people already lost interest in the disease itself back in May? And we're talking like 8 months later? So, I don't know. Moving on. All right, so this is where we get into the long-term effects of the vaccine itself, okay? So we have to admit, oh my goodness, vaccine injuries actually happen. And so what happens here is all the people who report on them, which are just like YouTubers, Twitter people, right? This made-up science blogger, Epigirl, she comes up with all these, side effects, and she makes maps of where they occurred and things like that. But that's all just anecdotes, okay? Everything that anyone comes up with, because the scientists, of course, have already come to the conclusion that it's effective and perfectly safe. So all the stories to the contrary are dismissed as anecdotal. Okie dokie. But what if the vaccine itself is ineffective? Okay, this scenario does not even address that. What if it doesn't work? What if it actually causes these massive side effects? That's not something that they actually talk about, interestingly enough. And this part here, this takes the cake. Speaking of people who are opposed to the vaccine, actually speaking of people who want to get compensation for being harmed by the vaccine, the article says that they are displaying a fundamental misunderstanding of scientific research. Many demanded proof that the vaccines did not cause long-term effects. Yes, c'est un comble, as they say. You have to prove that the vaccine has a long-term effect in this world. Nutso but so. And then the food for thought here, in the same vein, despite the uncertain science about the link between Coravax and the reported neurological symptoms, why should health officials still communicate with compassion and genuine sympathy toward those in the vaccinated population who experience medical issues subsequent to being vaccinated? So the obvious answer is that it's because of the uncertain science, okay? Uncertain science about the link. Okay, so we don't know. It may be that this made up vaccine is causing neurological symptoms, okay? But what the answer I think they're looking for is officials must still communicate with compassion and genuine sympathy because they'll tune you out if you don't, okay? Because that's what this whole thing is about, is just you don't want to lose people. You don't want them to go into their echo chambers and start talking to, white supremacists, because that's what'll happen. And look at this. So one of their made up senior health officials in their scenario says, we have to wait for the data. People need to understand that fact in terms of what the actual long-term health effects of SPARS, of the SPARS vaccine. So look, we gotta rush the vaccine into development, but to see what the long-term effects of it are, we gotta wait for that, all right? And this is why people are upset. And the counterpart to this is from another made-up official. Communities around the country went through what some felt was a harrowing public health emergency, only later to confront the possibility, however slim, that the medicine we promised would help them may in fact be hurting them. Okay, how do some people feel that it's a harrowing public health emergency? Either it is or it isn't. This is the whole thing. How do you have the possibility of people going around saying it's a fake pandemic? It's, well, I'll just skip to the next chapter where it does sort of address that. And this is going to be the last chapter, okay? Or is it? Here. As with many public health interventions, successful efforts to reduce the impact of the pandemic created the illusion that the event was not nearly as serious as experts suggested it would be. All right, so damned if you do, damned if you don't, all right? If it works, people won't take it seriously, okay? So you gotta have a lot of people die so that they take it seriously, right? That's the obvious, obvious uh, implication there. But of course, in COVID-19, well, you got people taking it seriously, and apparently people not taking it seriously is what we're finding. But we had so many, so many deaths. Okay, well, okay, no. The point with this is nobody thinks it was successful. Okay, nobody in their right mind thinks that the government handled the COVID-19 successfully. Not even Donald Trump. Okay, yeah. So there is no illusion that the event was. There is no illusion that is caused by that. There's people who don't think it's serious, but it's not at all because the officials responded to it effectively. So that is just a weird, weird little thing. And then the conspiracy theory here. What are the conspiracy theories that this scenario envisions? All right. Conspiracy theories also proliferated across social media, suggesting that the virus had been purposefully created and introduced to the population by drug companies, or that it had escaped from a government lab secretly testing bioweapons. So, okay, I've heard this one, and it's just accidental. Like, that's the whole theory, is it just accidentally got escaped from a lab in Wuhan. That's what everybody says. Or they're trying to cause depopulation. But that's a problem. Like, theory says why, and this thing is not saying why. This is just, I think, dismissing like conspiracy theorists and saying that they just think wacky things for no reason, okay? But a theory says something's happening because of something, okay? So why I've never heard this before. Created by drug companies. People say that they have a cure for cancer, but they're just not letting us have it because it's so profitable to treat us, and that might be true. Um, but why would the drug companies create and introduce a virus if they didn't have a cure for it? Okay, if they didn't have a drug to sell, in other words. And so what's happening with this, you know, half-assed conspiracy theory is, it's just there's no reason for it. And so the ending, the conclusion of this whole thing is where we're at, and it just says um, we need more vaccines. Okay, the very real possibility of a future SPARS pandemic necessitates continued commitment to vaccination programs, as well as accurate blah blah blah. Everybody coming together. So that's another subplot of this whole thing is with the different countries disagreeing. That's bad because that undermines faith in their own the country's own health system. So it's kind of setting the stage for like a world a unified front in this kind of a thing. But we didn't really see that either in COVID-19. And so that about wraps up what I have to say about that. As you saw, I'm just going through and reading it and putting my own spin, which is basically the medical aspect of it as far as I understand it. So I want to reiterate that it doesn't seem to me like these guys really have a realistic concept of what a pandemic would look like, and they don't have the recent historical background just of the what we think are the pathogens that cause similar outbreaks, namely SARS and MERS. So I don't think this is. I don't know. Is this presaging COVID? It was written in 2017. I found the first reference to it was I think in June of 2020. So people were talking about it, and it just recently got some airplay with I guess Alex Jones. So the question is why? Is it all just like a made up thing? How much did this have to do? Basically, the document is created so that you can take these little scenarios and like literally, sit around a table discussing them with your planners, okay, your peeps, and figuring out plans for how to deal with each scenario. So was this done in 2017, and did they apply what they learned to COVID, and that's why we saw certain things? Maybe. I kind of I my take home message is this is kind of like too far down the food chain, and it's too implausible and uninformed to really play much role in development of this kind of a policy. But it was fun to read, and it was a fun video to make. So if you have any questions or if you disagree, you think this is definitely the blueprint. This is like the a latter day protocols of the learned elders of Zion. Then go ahead and scream at me in the comment section. I'd love to hear counterpoint on this issue. But with all that being said, I'm going to close this two-parter out and go to bed. And this is Evan Benton with Dogg from Air. Thank you and good night.